Next, we'll be talking about Alzheimer's disease, and our textbook begins talking about that on page 186. I'm sorry, 166. Alzheimer's disease is one of the many different kinds of dementia. It refers to a progressive loss of function in the brain. There tends to be a genetic tendency. It often runs in families, and they develop issues with the nerve cells in the brain. When autopsies are done, it shows that the brain size has reduced, and the areas that control memory and language are very much shrunk or diminished. They also find a decrease in acetylcholine in the brain, and that makes it more difficult to learn new things and to retain memories. The blood flow to the brain decreases. If you look on page 167, we have a cross-section of a regular brain and one that is affected by Alzheimer's, and Alzheimer's has to be verified by autopsy after death. You can suspect someone has Alzheimer's, but you're only really sure when you go in and you see the changes in the brain. Box 9.3 on page 167 has 10 warning signs of Alzheimer's, things you might see as it sort of takes over the person's personality. This gives an idea of the changes in a healthy person's brain and the brain of somebody with Alzheimer's. You can see with a healthy brain, it's a good size. It's got healthy functioning neurons with good synapses. In the Alzheimer's brain, they build up what are known as plaques, and the neurons begin to shrink and get all tangled up, and so they find the plaques and the tangles when they get in there and try to examine the brain and do a microscopic study of the cells. So we have some drugs that can possibly help with that. We cannot get rid of Alzheimer's, unfortunately, but we can relieve the symptoms, and that's what these medications try to do, at least in the beginning stages when the signs and symptoms are still showing up. One of the categories of drugs that might be used is a cholinesterase inhibitor. Cholinesterase is an enzyme that inactivates acetylcholine. It kind of cuts the action of acetylcholine short so that your parasympathetic responses don't just go on and on without any relief. So cholinesterase is necessary, but when the person is already showing problems with the balance of acetylcholine in their brain, the inhibitor of the cholinesterase can allow more of the acetylcholine to stay in the nervous system. So our drug of choice here is called donepezil or Aricept. It's going to have some mild side effects, GI problems mostly, as well as some joint pain and muscle cramping. The adverse effects can be more serious. The person can begin to have hallucinations. They can have cardiac dysrhythmias. Eventually, the mild GI problems could turn into GI bleeding. The person might find themselves more susceptible to infection, although whether that's from the medicine or just the progression of the dementia, it's hard to say. And they can have difficulty urinating, or the opposite problem, they can be incontinent. Once again, that's sometimes seen with Alzheimer's anyway. You don't want to give the cholinesterase inhibitors with any drugs that can prolong the QT interval when you're doing an EKG or ECG. And examples, once again, would be dextromethorphan, which we mentioned as not working well with Parkinson's drugs either. Quinidine, which is a quinine-based cardiac medication for dysrhythmias, and then fluconazole, and the azole medications are antifungals. They don't interact well with cholinesterase inhibitors. The person needs a baseline weight before they start taking this medication because of the GI side effects it can have, including anorexia. You want to assess for any signs and symptoms of GI bleeding. Nurses want to monitor patients who have asthma because it can worsen asthma symptoms. This med can be given in a tablet form or a liquid form or a transdermal patch, which is convenient as long as you leave it in a place where the patient can't reach. So sometimes the middle of the back is a good place because the patient sort of forgets they're there and they're not likely to run across it if they're picking at themselves like they sometimes tend to do. Box 9.4 can show some common adverse effects of cholinesterase inhibitors, so make sure you read over that, and it can affect all the body systems. Before starting, a patient needs lab work, and you might have to repeat that periodically. Usually, if there are signs and symptoms that make the family suspect Alzheimer's, there's going to be an Alzheimer's disease assessment scale done, and the person's going to have mental function tests to determine at what point they're starting and if the medication kind of brings that to a halt temporarily. Patient and family teaching is found on page 169. And there's 9 bullet points for patient and family teaching, as well as all the nursing implications on page 168. Another drug that's frequently given when Alzheimer's is suspected is a drug called NMDA, which stands for N-methyl D-aspartate. And these block the N-methyl D-aspartate from doing what they do, which is allow calcium in and out of the neurons. You can see that the trade name for a drug made to do this NMDA action is Namenda, so it uses all the letters for NMDA. NMDA lets calcium in and out of neurons, which is fine if everything is working right in your brain cells, but if you have Alzheimer's, it appears to lead to the problem of plaques and entangling of the neurons. So if you block that with an NMDA blocker like memantine or Namenda, you can slow the damage to the neurons that you see with Alzheimer's. Namenda can cause headaches, dizziness, constipation. It can also lead to adverse effects such as worsening mental status. The person can get even more confused, they can get depressed, they can have hallucinations. Once again, sometimes it's hard to tell if it's the medication or the illness advancing, and so healthcare provider really needs to be consulted when there's an indication of a problem like that.